the Society of, Biotechnology Promotion India is BPI, and KK Biotech has been, this is the third one in our series. The idea is, we are having stalwarts like Dr. Renu Swarup with us today, who has literally grown with the department, as an officer and rising to the level of becoming the secretary. And we are very fortunate that we have a lady who has seen all that happening in front of, where she was in the battlefield, as I would say. She was, seen it with her own this thing, and I'm sure it was not easy. But when I look at the bioeconomy, what is, as per the report I saw, $70 billion sounds very, very impressive. Certainly, I must say, a lot of people in the department have worked very hard. That's why we said, what is the role of Department of Biotechnology in the bioeconomy of the country? I think, and there's no better person than Dr. Renu Swarup to share her views and thoughts, because many of us we only hear few things, but today we can hear her being interviewed, and it is very interesting that we have Dr. Vivek Varma, who is also a product of the vision of the Department of Biotechnology, the first batch of human resource development. And, and they also, when they started also, they didn't know what the future was. But it's very nice to see that they had trust in biotechnology, went on to do a Ph.D. in molecular biology, plant molecular biology at NCL. And then later he went to the industry, and he has spent more than 25 years. And he has also helped some companies to be set up. Without taking too much of time, I hand over Vivek, and please start the proceedings. And thank you both, Dr. Renu Swarup and Dr. Vivek Varma, for kindly agreeing to participate today. Thank you. Over to you, Vivek.
Am I audible?
Yeah. Yes.
Okay. Thank you, Professor Kannan. It's been an honor to be introduced to this forum by such a stalwart who's been in the biotech industry for such a long time, number one. Number two, and more important, is that he has also been my professor when we were doing our biotechnology from the University of Pune. And as I mentioned, that I've been fortunate to be a part of this department since its inception. And I should also be proud to say that I have not had the opportunity to interact with Dr. Swarup, but her name has always been in the forefront of the department over the past, I think it's almost 40 years now. And with that, I think I would like to know a bit about your views on the contribution of bioeconomy to the GDP of the country, because there is a lot of focus in the area of biology right now. And in that respect, Dr. Swarup, I would like to know your views on that.
Thank you very much, Dr. Vivek Varma. And first of all, thank you so much, Dr. Kannan, and the society, which is led by Dr. P.K. Ghosh, Dr. John, and all other colleagues from DBT. I think that's a wonderful forum you've created, where you can bring in people to discuss the key issues of biotechnology, and more importantly, the way forward in many, many new areas. I'm sure as the forum moves forward, you will sort of bring into your fold many of the younger startups, researchers, the MSc biotechnology students, and many others. So congratulations and compliments on that. It's nice that I'm here with all of you today, and I think the topic that you've chosen is also very pertinent. If you're saying role of DBT in the bioeconomy, and Vivek wants to know what really role has the bioeconomy played in the GDP, let me say this, that DBT and biotechnology, they're synonymous with each other. Because as the biotechnology grew in the country, I think it was DBT which took on that main responsibility. When we started as a board in 82 and then as a full-fledged department in 86. So in all these years, if you talk about bioeconomy, clearly the biotechnology has played a huge role in it. How the bioeconomy impacts the GDP, we can go by sheer numbers. Numbers, of course, tell you what Dr. Kannan said right now. We've been growing at about 12%. We've got 72 billion was at the end of the last year. And this year, right now, if you look at it, it's probably the recent figures I have is it may have crossed about 80 billion, inching towards reaching 90 by the time we reach into next year, because our target is obviously 150 billion by 2025, a target that we revised in 2019, because till then we were saying 100 billion by 2025. And when we had the Global Bio India, everyone realized that it was an underestimation and we could do much better. Well, if you look at the numbers, it could be, okay, it's a 3% of the GDP, or we're going to move into 4% of GDP, or last year it was 2%. As I said, these are sheer numbers. But what is important is the impact that biotechnology and the bio is making onto the larger bioeconomy. And you also have to understand that bioeconomy roadmap for our country, it's more of a knowledge-driven roadmap. It's a knowledge-driven economy that we are talking about. So while we look at the tangibles, there are a lot of intangibles that don't get accounted for. And those also in some way impact the bioeconomy when you look at it, or the overall economy of the country. You look at a recent example, COVID, because that's fresh in everyone's mind. What did we do? With biotechnology, we've tackled some serious problems that we had in the country of diagnostics and vaccines for helping in the, trying to bring in the vaccination program, diagnostics for testing against COVID. Now, this can be looked at with two angles. One side is what impact did that have on the biotech industry? And obviously, what was the commercial part of the industry automatically impacted the bioeconomy. And if you see the recent bioeconomy report, even the one that is currently being discussed in today's scenario, a major chunk of it is going to the COVID-related activities. So that impacted, because it saved us a lot of foreign exchange because of import substitution. We also have now got into an area where we are looking at our diagnostics being exported. So there was a whole, commercial angle there. But what we are not calculating is the lives that it saved, is the health, the burden that would have had on the health infrastructure. So that also automatically, in some ways, going back into the larger economy of the country. And I think and that's only one example that I've given. You could look at it in all other areas, whether it's agriculture. In agriculture, you're looking at improved varieties. When you come in with improved varieties, there is improved nutrition that comes on. When there is improved nutrition that comes on, then there is obviously a better health scenario that we work on. Similarly, you talk about clean energy. When we talk about clean energy, there is the biofuels that we are talking about. So everywhere, there is an impact that we have, one in terms of the actual numbers that those products impact in terms of the products which are coming into the market. And the related numbers which do not get accounted for is the livelihood, the other, the job scenarios that it has created. There's a whole industry around it, which so far is not getting calculated. I've been urging people to bring that also, and probably we need social scientists to get into our larger report. Those would be numbers that will play a very important role.
in continuation with that, now that we were talking about the local impact on the GDP, that's fine. Now, what was what is it from your perception, the global perception of the Indian bioeconomy vis-a-vis the biotechnology situation in India? The
So,
global perception.
so if you look at the numbers, again, the numbers, if you see, uh, one is in terms of the positioning that the biotechnology industry has in India vis-a-vis the global scenario. DBT, when we started, when DBT was set up as a department, we obviously focused very much on the infrastructure, on terms of the human resource, and also the industry infrastructure. Today, if you look at the industrial growth, there is a lot of emphasis which is there in terms of the quality infrastructure, which is important not only for our own products, but for products which would impact the global market. In that sense, we look at it, and there are different statistics which come out and say, okay, India occupies the 12th position in terms of the infrastructure or the US FDA plants, etc. In Asia, we occupy the third position. If you look at it from the bioeconomy point, what are today's economy is of about 80 billion, or contributing about, let's say, about 3% or 3 point some X percent of the GDP. We would again be, say, we just about below the first 10, 12, or that's the number. But the potential for moving forward is so much greater now, considering that we have today been able to establish the cutting edge infrastructure. We've been able to, in all the fields, if you look at the way the startup community is going, because they are eventually the ones who are going to make an impact. We are looking at sister innovation hubs. We are looking at incubation connect programs. So you have an exchange of startups between countries. And when they look at an exchange of startup, then it's their products, which again have markets which are accessible globally. So in these products start going there, we obviously look at the potential so much higher. Today, as I said, we are between 10 to 12 is the positioning that India has. But our target is to reach within the top 5 countries in the next 5 years. And I'm confident that the way they're working, we would be able to do that.
Oh, that's a pretty ambitious target. I hope that we should be able to reach there. Now that we've been talking about biotechnology or bioeconomy, that's a very a huge word, is what I would call it as. It encompasses a large number of sectors. So, which are the sectors that the DBT is focusing on, so that we can take it in to the next level? But there are enough, let's say, agriculture, bioagriculture, fertilizers, diagnostics. I have been in all of these fields, so with that is why I'm asking this question. So, which is the area that the DBT would love to focus on?
So again, I think it's important for us to step back for a moment and see that what has DBT actually done in all these years. If you look at it, DBT has focused, and that's what I said, if you look at DBT, biotechnology, they're more or less synonymous with each other, because that's really been the growth of the biotech as a sector as a whole. We have focused on cutting edge technologies, irrespective of which sector it's making an impact, whether it's agriculture, whether it's industry, whether it's biopharma. The whole purpose and the vision of DBT has been to see how you could look at applying newer technologies for bringing out improved products and processes to be able to impact society. I mean, in a very simple layperson's language, this really is the key message that DBT has for every stakeholder, every officer of DBT, every scientist who works along with us, that our ultimate goal is to look at it in that way. To achieve that goal, we obviously have to impact every sector. You cannot just pick up one sector and say that. So it's cutting edge technologies across sectors. Yes, that's a different matter, that if you look at the bioeconomy statistics today, clearly the biopharma occupies the largest chunk of that pie. That's because biopharma came in very, very early in terms of newer products. And those products today, we have the biopharma industry, we obviously got into biosimilars, and then of course diagnostics and vaccines. So the biopharma has the largest chunk. Agriculture technologies again have a huge impact that they can make. We did go initially a lot into the transgenic field, which has its own regulatory complexities. Very quickly, we adopted newer technologies like molecular breeding, looking at, and now we are very pleased that the gene editing technology guidelines have been released. That will again give us a boost in terms of the newer technologies that come up. So in every area, you go to the clean energy area. In the clean energy area, again, while biofuels was one aspect that we were looking at, and today it's a matter of pride for every scientist when we hear the Honorable Prime Minister in all the various achievements that he talks about, including the Germany visit that he had yesterday. He spoke about how India has achieved its 10% target. Now, that 10% target comes from the technologies of bioethanol, which have been obviously a lot is contributed by the biotechnology. So I think every field, you look at enzyme, our whole focus on enzyme technology. And all these, again, have an impact. Now, today, when we move, even in the biopharma sector, we are focusing a lot on our new technologies that you're looking at. You're looking at CRISPR, you're looking at CAR-T technology, you're looking at stem cell technology. So all I'm trying to say is that DBT has always focused on cutting edge technologies. Those cutting edge technologies could be across sectors, knowing this, that if biotechnology has to impact, it has to impact across sectors. Only then can it really make an impact on the bioeconomy.
Oh, that's pretty interesting because coming from my experience in the last 25 to 30 years, wherein I've had the opportunity to be in the manufacturing zone, as well as the marketing of these zones. Many of these products are manufacturing diagnostics, etc. I just would love to know the amount of the resources that we have generated over a period of time. Let's say that the Department of Biotechnology started in 1985. The first batch of biotechnologists like me have come in. We have around 40 years of biotechnologists in the country. How does the DBT look at harnessing the potential of all of these people?
So we started as a board in 1982 and then became a full-fledged department on 26th of February 1986. So it's 36 years to be precise that we are a full-fledged department, but yes, 40 years as a board. So an independent board, it's been 40 years that we put in. So you have to first trace out the journey of these 40 years. What did we start with? Our focus was on building a very, very strong foundation. To harness the potential of any resource that you have created, you must first do a complete holistic ecosystem building. Only then can you start harnessing the potential of it. You know, you have to first plant the seed, nurture the tree, make sure that it's fruiting well. Only then would the fruits be ripe enough and sweet enough for everyone to eat. And that's exactly what we have done. And you cannot say that, okay, I'm only going to put in one particular nutrient into the tree, or I'm not going to put in the other nutrient into the tree, or I'm going to make sure that only while the flowers come out, I'm going to look after it. No, it has to be overall. You have to nurture it. And that's really what we have done. We've nurtured this ecosystem. We started by building capacities because that's the foundation. Unless you have a strong foundation, You will not, it's like a tree. Unless you have very strong roots, in any storm, you're going to lose that tree. So we needed very, very strong, deep roots. And how did we do that? We set up the Human Resource Development Program, which you yourself are so proud of being in the first batch of it, or part of it. Not there. We created very strong institutions. Our whole focus was on creating institutions. If you look at it today, DBT has 16 of its own institutions. But DBT also built up a very solid system where we did not depend only on our DBT autonomous institutes. The DBT autonomous institutes were built because of special niche areas that they were working on. But DBT is a unique department, along with the Department of Science and Technology, which supports, and DBT does the biotechnology part of it, across all laboratories and universities in the country. Today, we very proudly say that if in any laboratory there is good biotechnology happening, there would definitely be a DBT presence in that laboratory. I don't think there's any laboratory in the country in which there is biotechnology happening where DBT is not there, either in the form of research grants, or in the form of infrastructure, or in the form of equipments, or in the form of their students, whether it's JRFs or SRFs or RAs or postdocs. So what did we do? We very slowly and steadily built that ecosystem across the country. And pan-India, we created strength. Now, this strength which has come forward was then the basis of moving into the next level. And the next level was, how do you focus on cutting edge technologies? And this was also in line with the changing message that we got from our policies as they moved on. When India became independent, our first science technology policy resolution spoke about how important it is to focus on technologies, but also to look at partnering with countries for receiving technologies, for technology transfers. Slowly, there was a shift, and we no longer were technology receivers. We became co-developers of technology. Today, India has the strength of being co-development partners with the best of international groups. So this is how we harness the potential of the strengths that we created. We started building our strengths in cutting edge technologies. As we moved on, we then looked at areas which were of specific importance to us from the industrial viewpoint. So that's where it was going to impact now. So you see, how does the industry grow? It's basically the deep learning which comes in from the academia. That's the right way to do it. The academic learning and knowledge, which then moves into the industrial growth to be taken up forward for translation, commercialization, and eventually reaching the market. So we did that. We then started building industrial partnerships. Now, these industrial partnerships that we built up, and if you study our DBT strategy, we put out the first vision in 2000, and then we had the strategy in 2007. Then we had one in 2015, and then we had one in 2021. Each one of them gives you the flavor of the growing ecosystem. As we brought in industries, we then realized that we needed startups, because that's how the whole ecosystem is going to move from discovery to innovation to enterprise. That's the whole cycle that we follow. And today, we do boast about India being one of the largest startup nations, but we have over 5,000 startups. Where do they come from? They come from this base that we've created. They come from our MSc biotechnology courses. They come from our IITs. They come from our ICERs. They come from our laboratories. Scientists move out of laboratories to take the risk. But why do they do that? Because we've created an ecosystem. We have the largest startup ecosystem, and BIRAC was set up in 2012. We started with just less than 50 startups. Today we have 5,000 startups, over 5,000. We had no incubation center. Today we have 75 incubation centers. So 16 autonomous institutes, more than 50 centers of excellence of cutting edge technology, more than 5,000 startups. And at any given point of time, there are nearly 5,000 projects which are running. Over 15,000 scientists get supported. So this is our strength. And what you see the big bioeconomy growing is how we've harnessed it.
Oh, that's very interesting. And coming back to the recent past, as to how did the Indian the ecosystem of biotechnologists across the country, that sector, how did they respond to the COVID pandemic? That would be just love to know about that, a little bit, because it came in suddenly and there was a sudden blackout. We were importing material, and by now we are exporting material. So I'm sure that there must have been a lot of interaction that goes on between academia and the industry. Which, let me put it personally, there was a time when the biotech was being developed. We didn't see it at the beginning, but I do see that moving very fast in the present scenario. So how did it work? If you can.
So Vivek, this is actually a wonderful example of what you just asked me about how do you harness the potential of the resources that you have deployed. So over these years, we created a very strong ecosystem, as I mentioned to you. Biopharma was our strength, has always been our strength. From our first secretary, Dr. S. Ramachandran, and Dr. Ghosh is here, he will recall how Dr. Ramachandran focused on the biopharma sector because he himself came from the industry and he had a lot of, and that's how we built it. Similarly, agriculture and others, but biopharma was our strength. We, through BIRAC, had already created these industry academia partnerships. So the boundaries that you had between academia and industry had already started blurring. There was more trust between the two groups and they were working together. We had created bioclusters within our DBT ecosystem. We had two bioclusters, one in Bangalore, one in NCR at Faridabad, where we have DHSTI, RCB, and then Bangalore we have in STEM and NCBS and CCAN. Now, we had already understood what goes into translating technologies. So that was the base that we were creating. And then, as I said, we had this robust ecosystem of over 5,000 startups. In 2018, we, along with the World Bank, launched a national biopharma mission. BIRAC was given the responsibility to implement that. That was the first large 1,500 crore mission that DBT took on with 50-50 funding from Government of India and a loan from World Bank. With this, we created a very, very strong foundation in biopharma. We created shared infrastructure facilities. We created biorepositories. We looked at creating platforms for testing of devices and diagnostics. We created platforms for accelerating the vaccine development program, biosimilars. Our whole mission of the biopharma mission was, or the goal of the biopharma mission was accelerating innovations for India to achieve or to take them quickly to market. No one ever dreamt at that point of time that in 2020 we're going to have a pandemic, which is going to actually be a test case for this biopharma mission. And then in 2020, when we suddenly this pandemic was announced, you're very right, DBT was one of the first departments which took on the responsibility for the R&D and innovation. I do recall that it was, I think, maybe 27th or 28th of January, where I took a meeting with all the directors of our institutes and others, or maybe even before that. I think the day we realized that we were getting into some serious problem, to create a roadmap for what is it that we're going to do for vaccines, diagnostics, and for biosimilars. And in WHO, on 6th of February, when the R&D roadmap was presented, India was one of the first countries to present their roadmap. Now, as early as February, we presented our roadmap. And immediately after that, what we did is we started work of what we called the R&D consortium. R&D COVID consortium we created. In this R&D COVID consortium, we immediately brought together industry, academia, and startups. And we said, you're going to take on responsibilities for key products, whether it was vaccines or diagnostics. We then immediately took on, we identified the gaps and we quickly started addressing them from existing infrastructure that we had. Then, of course, in 2 months' time, we launched the mission COVID Suraksha. Again, a 900 crore mission for producing indigenous vaccines. India was one country which had the largest portfolio of vaccine candidates. We supported 35 vaccine candidate groups. I'm not saying 35 candidates, but 35 groups who were developing candidates vaccine. Yes, many of them did not move forward. They were in early stages, some in pre. We all know how it goes. Every candidate cannot move ahead. Every group cannot achieve success. But we created those. And then, of course, today you see we've got the largest immunization program in the world with our own vaccines. The infrastructure that we created in our translational centers, we set up immunoassay labs, we set up animal model facilities, we set up biorepositories, because these were those burning points where the industry could not go ahead for developing diagnostics if they did not have the assays with which they could test the diagnostics. So we immediately created validation centers. We created guidelines for sharing of biosamples, of creating these panels of assays and giving it to startups so that they could validate in-house their own diagnostic kits and move forward. The immunoassay studies, in fact, THSTI got recognized by CEPI as one of the international centers in the 7 which they did world over for immunoassay studies. We set up 54 clinical trial sites so that we could have multiple vaccines going into clinical trials. So this was all planning that we were doing, advanced planning, creating that ecosystem and making the ground ready for our industries to just move in. We saw wonderful partnership between industry and academia. We are hoping now that this learning is going to go beyond COVID.
I'm sure about that. The reason being that I was during the pandemic conditions, I was also involved in the technology transfer from NIV for the ELISA kits and for the RT-PCR kits for the company that I was working before. So, and the response that we got from these institutes at that point of time was very remarkable. And it was completely different from the time, let's say around 20, 25 years back. The kind of response that we used to get it from academy was not as rapid as we get it right now. So I believe there is a tremendous amount of change that has come in on both sides. Coming back to that, I just wanted to also know about the challenges that you must have faced, let's say, when the course was started from the industry, because it's a new, biotechnology was new, industry academy was not that, the industry was not that comfortable. And at that time, you must have definitely faced a lot of challenges from the industry to adapt or adopt people from this course. How did you manage that?
You're talking about when DBT began?
Yeah, almost, yes. It's like when I started off, this was one of the questions that we always used to ask. Because, okay, I have done my MSc in biotechnology. What are my industry prospects? And now of course, there's a lot of change. But at that time, how did the industry take it? Because academically, yes, I can understand that.
So let me say this, that like any other sector, it's been a challenge. Initially, it was a challenge because for two things. One is it was a growing industry. They had their own specific needs. At that point of time, we were not talking too much about industry being a partner in the research aspects of the academia. It was always about academia doing a particular research and then handing over or doing a technology transfer to the industry. And that's where all the problems would begin, because the industry would say your technology is not ready. The academia would say we are ready to transfer. The industry would say that when we take it from lab to even pilot, there's a lot of optimization we have to do. So on the whole, as I said, there was not enough understanding between those two key stakeholders. Because of this, since most of our human resource development was happening in the academic field, whether it was universities and colleges or research institutes, it was difficult for them to understand what would be those special skills which the industry would require from this workforce which moves out of the graduates out from our colleges. As we moved in these years, the human resource development group of DBT took that on as a very major responsibility to connect academia and industry to increase the employability of our human resource. Number of steps were taken by them. We started by making them part of the group that would plan out the course curriculums so that they would take that on. Very early on, we started what we call the Biotechnology Industry Training Program, the BITP, which is still running. At that point of time, the students, when they would finish their MSc, would get a 6 months sort of an internship paid by DBT. And the industry would be paid as well to take them on, because at that point, the industry was not willing to accept them. So the industry would be given a workforce and be given money by DBT to accept that workforce. We did well in that. A lot of students who performed well in good industries were actually absorbed by them, and the numbers were increasing. We started by 10%, 20%, and the last maybe I heard was about 40 to 50% was the numbers they were looking at. Recently, in the last few years, when I was heading the department, we brought about a slight change. We started linking this BITP with the government's apprenticeship program, so that the Skill Development Council got on board. And the Skill Development Council coming on board, it sort of gave us a larger portfolio of industries who would come in, because the industries were also mandated as per the government norms, apprenticeship norms, to take on apprenticeship. And with this, they could take this on from here. So this was one way that we did that, and we worked along with it. The second aspect that we started is we did it very well in Karnataka. First, to begin with, we started what we called finishing schools. And the finishing school, the whole purpose was exactly this: that after they finish their MSc, they have 1 year where the industry is partner to the whole program, to be able to see what are those skills that you need to give to these students. Now we have started in the last few years a program that was called Skill Vigyan Biotechnology Centers. These Skill Vigyan Biotechnology Centers have now been done with the state governments. Till I was in DBT, I think it was about 10 states that we did it in, 10 or 12 states, and the whole target was to cover all states in the country. We had got a good response, applications that started coming in. And again, the whole purpose was that you don't only look at the industries we interact with, but the state governments take on the responsibility as well. So the states have different, their own industries. And the other point is that these students may not be just for the hardcore biotechnology research innovation industries. They may be important for other related industries as well. Because if you're looking at somebody who's coming in from the biotechnology field and getting into the agriculture biotechnology area, they could be sort of important for other areas as well. So I think we've taken a lot of initiative, and now we are seeing that this is creating an impact, and we are seeing more and more employability. And of course, now our most successful, um, path that many of our students take is the entrepreneurial path. So you have many of your students who come out from your MSc courses and all, GRFs, many of our SRFs who we have this big grant. The big is the biotechnology ignition grant, which is a 50 lakhs that they get for a period of 18 months to try out their proof of concept. The most in demand. We also have Sitare grant, which is for young students, which is a 15 lakh grant that is given. So we have different EUR schemes there. So number of schemes to catch them at different levels of their education. And there's a huge response to that. So this is how we are taking our workforce into different areas through industry channels.
Yeah, I can, because when you are speaking about entrepreneurs, I have a couple of my own friends and my classmates who have gone down that path. Some of them are in Bangalore. They are doing pretty exceptionally well, and they use the facilities of the biotech for the research grants and the stipends, the internships. And well, I believe one of my colleagues who's there in the US, who's also, I think he is part of this talk, Dr. Sudhir Das, who's also a first batch biotech, who's based out of the US. He's got his own firm. He's been working, been there for the last 20 years. And I think he started something in Kerala. He started a separate unit just recently in the last couple of years. So I believe the initial investment that many people, the biotech, the Department of Biotechnology has put in is working on fruition. With that, I would just like, if there is someone else who would like to ask some questions to Dr. Renu, it would be, it's open.
Yeah, Dr. Renu, I think you really presented the real view of the thing. But I must also say, somehow students are not aware of, our publicity has been, I feel, not that strong. You have done so much, the number of programs you said. I wish every student who joins a undergraduate program or a postgraduate, I think you must give them a booklet or something, what you can do, because many of them only think to do research or go abroad. They don't realize that there's an ecosystem which has been created, and we need a critical mass of people to allow that ecosystem to go. So is Department of Biotechnology looking at that aspect seriously? Because this is very important, I feel.
But Dr. Kana, first of all, let me say this, that the time for students reading books is gone now. It's all social media, it's all internet, it's all on the web. So we have created a portal. And on that portal, there is information on a lot of human resource activities. We then have the India Bioscience Group, which is based in Bangalore, but they do a lot of these young investigator meets. So every year they do these young investigator meets. We then have the Ramalinga Swami conclaves that we put in. We have similarly workshops that we do on an annual basis to spread this message. And I always tell everyone that for DBT, stakeholders, we have such a large extended family. As I said, anywhere, any biotechnology happening, DBT is part of it. So they really are the champions for biotechnology. They are our voice. They are the ones who have to spread this message across and take this message to different universities, different colleges. Now we are setting up this whole concept of mentor-mentee institutes, where you're creating clusters. In the clusters, you're finding some of the key institutes which are in the metros or in the A-class cities, going to tier 2, tier 3 cities. We have started this whole infrastructure of Sahaj, which is again making equipments accessible to remote colleges. So these institutes have been given the responsibility to bring these colleges. And with that, I hope that the message goes forward. But yes, you're right. I think by nature, scientists are not good communicators in terms of communicating their achievements or So we do need a science PR agency.
PR, yes, correct.
Communication agency. Vigyan Prasar is doing a good job now from DST. They've sort of
Yes.
connected with all departments, but I'm sure maybe societies like yours, I have been saying this to Dr. Ghosh, Dr. John, that's a task that you all can take up. You should try to take this message of biotechnology to as many students as you can. You have a large forum, and you should try to do this. Maybe forums like yours are the best place to convey this important message.
In fact, you will be surprised. We did one section of question answers. The audience can ask the question. They send me the questions in advance, and I try to answer each one so that they are able to feel. You know, they were quite surprised when I told them, look, have you ever gone to the DBT website and seen? Because once you open, you will realize that name any field and DBT is there. You know.
Yeah, so I think it's important. We had also started series of webinars where we connected with a lot of colleges. You know, DBT has its star colleges, it has MSc programs, a huge number of colleges that we connect with.
Yeah.
And I don't know, these sort of programs, do you put them on the YouTube, etc.?
Yes, yes, it is on the YouTube.
So you should connect to colleges. You should connect.
No, the best part was, which I must share with you, that there are a lot of teachers who did their MSc and became lecturer. Now, many of them are keen to do research. So they come to me and ask, sir, you know, I have to teach, I have to earn my money, but can you help me to do a PhD? So that is a new trend which I suddenly saw. So I have about half a dozen students whom we are trying to help to do PhD. So what we do is we give them an orientation program, then make them solve the problem, then identify a problem for themselves. You know, so what happened, suddenly I'm seeing that this is a niche area which accidentally we discovered. I went to talk to students and I found the teachers were more excited that we would like to do something. I think there are a whole lot of teachers who have become teachers without a PhD. I think they are a niche group. I find if we can promote some of these things, I'm sure it's going to make a big impact. I totally agree with you. I think all of us have to put our hand, you know, whether we are retired or we are working. I think we have a social responsibility to make people aware of. And I think that's what I've been telling Dr. Ghosh also. SBPI also should make a, you know, the title is very important. Society, you know, Biotechnology Society for Promotion. Now, what promotions are we doing? That's how we join hands. I said, let us promote it more. People like you coming and talking, you know, it makes a big difference to the young minds. When it goes to YouTube, you'll suddenly see a lot of people watch it because they look at the title. They never knew the word bioeconomy exists, very honestly. They've heard of biotechnology, but they said there's an economy due to biology. Something is a new buzzword. And I think the department has done a great job by bringing out that brochure and details and things like that. I totally agree. I just have one question. If suppose DBT was like Department of Atomic Energy or Space Program, okay, because there the way they operate is quite different from DBT spreading out to so many places. Do you think suppose we were like a Department of Atomic Energy, how fast would we have grown? It's just a hypothetical question, but
so it's first important to understand what is the difference in DBT and atomic energy. I think DBT is different from other science ministries because DBT has a combination of a conventional science ministry and what atomic energy and space do. Space and atomic energy chase missions that they identify for themselves and launch it. You know, whether you're looking at Chandrayaan or you're looking at different satellites that you're putting in, or in atomic energy again, they're not a funding body. They don't support or create an ecosystem outside their own domain. DBT does both, which is very important because DBT, while we do have missions, and you have looked at the missions, and clearly COVID was a case before you where we've looked at vaccines and diagnostics, and that was taken up totally in a mission mode. There was no difference in the functioning of DBT from what atomic energy and what space would do. It was like a space mission. You were looking at Chandrayaan going on. In fact, in one of the interviews that Pallav Bagla did with me, he asked me, what do you call the vaccine taking off? Do you relate it to a space mission? I said, this is a vaccine yarn that you're talking about. Flown all over. But we also complement it with creating the ecosystem across the country, which is very important. But you see now, space is doing exactly that. Space has opened up its department now to allow startups, to allow private sector to come in. So that, because you have to realize that solutions will come from this very large base that we create and then take it into a mission. So I think DBT has grown very well with the pace it can, and rightly kept a combination of both extramural and mission mode approach that we've taken.
Yeah.
We started from the oilseed missions. We started from early, way on our, when DBT began, had missions. The bamboo mission, the oilseed mission, number of missions. I mean, I can name the whole lot of them. You had the first ETT calf that was born out of a mission that DBT supported. So in every area, aquaculture mission, we had tissue culture was a mission. These were all missions that we took on. And then, of course, we started this research support that we've given.
I just have one last question before many of our students who passed out of the biotechnology program of DBT, some of them are made big names abroad. You know, some of them have led some of the biggest projects what America boasts of. You know, whether it is like mRNA vaccine, you know, you hear all the Indian names, you know, or CAR T cell technology. I think department, it's just a suggestion. I think the DBT should find out our students abroad who are passed out from here and what they are doing and how they are contributing. Because there is a lot of demand for our kind of manpower trained even abroad, even in USA, Europe. Has the department ever recorded that?
So very good suggestion. When we did some of our recent Global Bio India and science festivals, we did try to connect with the Indians abroad. We did forums of the Global Indians in Science and Technology, GIST as it was called. But I think it's a wonderful suggestion, and maybe you should write to the present secretary or the human resource group now to create an alumni portal. And I think the HRD, we were talking about it, but somehow it didn't get started. It's a good idea to set up a HRD alumni portal, and maybe some of the alumni, you see everywhere the alumni play a very important role. Whether it's the IITs, whether it's the ISER. So somebody like Vivek and their team should really look at creating an alumni portal and connecting all the alumni to DBT. Let that be their contribution to the growth of the biotechnology.
I totally agree, because I was very surprised that we have vice presidents in Bristol Myers Squibb who passed out of biotech program, directors in Pfizer. You know, when I start looking around the platform, I said, yeah, how come we have not recorded this? Because this is also our contribution. This is the department's contribution to the world. One is to India, but globally we are contributing.
Vivek was on a call, so probably didn't hear what I said. I said, Vivek, alumni like you will have to put in and contribute to creating an alumni portal, so that all alumni come together, and that will be the contribution that the alumni will give to the biotechnology sector.
I put my hands up.
Can I ask a question here?
That is a good idea, ma'am.
Somebody else who wants to ask.
Yeah, somebody wants to ask a question. Sorry, I took so much time.
Yeah,
Sudhir. Yeah, Sudhir. Yes.
Yes. Okay. You can hear me, right? Okay.
Yes.
Yeah. First of all, I want to say that Department of Biotechnology has done an excellent job, especially for helping with infrastructure development and education. But I feel that there are a couple of areas they are lagging, or maybe I am not aware of where it is. So one of them is marketing this biotechnology internationally, Indian biotechnology or Indian biotechnology products. Second one is regulatory issues. I myself faced some of those in my journey. And finally, I want to point out that, you know, Prime Minister is promoting Make in India. But I feel that one of the problem we are facing is still the cost of Make in India is higher than, you know, for example, in US, some of the materials to be imported. So again, I am talking about from my first-hand experience. Earlier we were talking about all these Indians in major companies in US. So why don't they set up shop in India? So these are some of those problems like regulations and additional cost. So I can do the same thing sitting in US cheaper than in India. So these are the problems maybe we need to address as a biotechnology department at the Government of India level.
So yes, let me talk about the three things that you have discussed. One is the branding DBT or branding biotechnology or its products overseas. I think over these years, if you have seen, the biotechnology sector has clearly got a much larger canvas now that we have for international collaborations. Every country that looks at anything to do with biotechnology looks at India as a preferred partner. Destination for products, I just spoke a little while back to say that we've created these, because that's more of a startup and an industry portfolio that has to move ahead. That's really where they look at their products. But there's clearly a market. The market is not only with branding, the market is also with the quality of the products that you bring out. It's also the global market, niche areas that you need to capture. So industries have to play a major role, and DBT is there to support you through this ecosystem that we create. The second that you spoke about is the complex regulatory ecosystem. Yes, I do appreciate the fact that biotechnology has complexities, but over the years, there's been an effort to make it more transparent and make it more efficient, more responsive. One part of it is looked at by DBT. The remaining larger part of it is looked at by the Health Ministry through the DCGI's office, where you talk about pharma products. For COVID times, I think there was a clear emphasis. We brought out a rapid regulatory guideline, we had a rapid response system. The committees were meeting literally, it was working 24 hours to give accelerated approvals. This learning now needs to be translated into other areas as well. How did it work so quickly? It is because we gave very clear guidelines as to what the industries need to do to deliver products. And I think that is what DBT needs to do now, along with the Health Ministry. And this was my message to them while I was there, that please ensure that you create these guidelines for every product that you're working on. So we did it. We did it for the nano products. We did it for the nano agri, the nano pharma. So if these sort of guidelines come out, it makes it a very transparent and a responsive system. The third point that you spoke about was the cost of the products. There were certain products in which there was import of the products and raw materials. Things would make it more expensive. So there was a reverse duty concept in it. We have been taking industries' requirements, sending it to the finance ministry. Some of them have been resolved. Diagnostics, for sure, I know that this was a burning point that they had. Now a lot of it has been changed. We were looking at only 20% that was being built from in-house, and 80% was being imported. Our target is we reverse that now, and we bring in 80% in-house and 20% gets on, and probably not even imported, we export it out for that. So all this comes in with the cost of, there was also another problem that we had. When we looked at the diagnostics for COVID, we realized while we gave them a challenge to develop indigenous COVID diagnostics within 60 days. The startups, the industry took on that challenge. But when they took on the challenge, the key issue that came up was that all their raw material was being imported. So they said, ma'am, we still have supply chain disruptions. We'll develop the diagnostic, but what do we do? And it was very simple raw material that was required, I was very surprised that even a Taq polymerase was being imported. This was the limit of it, absolutely. So what we did is we created NBRIC. NBRIC was a platform that we created through CCAP, and we said it was an aggregator. So we gave them a assured demand, and we said these 100 startups need X amount of this raw material. So all these companies, industries who were actually producing, they were producing it for research purpose. They were producing it for there, but not for commercial purpose. So we gave them an assured demand. They came in with an assured supply. That immediately brought down the cost. So today our diagnostics became so affordable that not only within the country. So if we can do it for one particular sector, we can do it for all. So we do have examples. We only need to put it to practice.
Okay, thank you.
Okay.
Can I ask a question?
Yes, please go ahead. And I think
Hello, I'm Sonika Bhatnagar. Ma'am, first of all, let me say it's such a pleasure to meet legends literally from the biotechnology area where we've been working for so long. I'm currently at Netaji Subhash University of Technology. I'm heading the Department of Biological Sciences and Engineering. So I know that a lot of our IITs and NITs have taken uh, benefit of the DBT support to the PG programs, and we were also looking to the for the same for our PG programs. We have a program in biochemical engineering, another one in bioinformatics. So, I find that the DBT Builder program has not been floated for a long time. Is this something because of COVID, or should we look forward to this in the near future?
I can tell you what happened till last year, October. Near future, you'll have to talk to the new secretary who will tell you what the plans are. But let me tell you that no, I think the whole purpose was because we were going into a new 5-year cycle for our, so everything else was being, revamped, guidelines were being done. And yes, COVID budget did take away some of our key aspects because we obviously had limited budget that we had to put in. So the Builder program was very much there, and I hope that the department will continue that, because that has received a lot of not only the response has been very, very enthusiastic, but we've seen the impact as well. So I'm sure it will come, and probably when it's going to be announced, you'll have to check with the current officers who are dealing with it.
Thank you so much.
So I think we're on time now.
Yeah. We are over. It's my just the pleasant duty to thank Dr. Renu Swarup for finding not only time, but you gave your feel of your years of experience and how much the government has worked very hard to push this sector. We didn't exist in the 80s, and suddenly today it is a major sector. I think I must compliment the whole department, which had that work culture. I mean, more important is the work culture, which encourage others to do it. I'm sure there was some wrong investment, there was some good investment, but that's part of the game. But I'm sure today it came out very clear that DBT always is willing to take 10 steps forward. It is only left for the younger generation to take advantage of the support system or the ecosystem which it exists. And I also feel that if a student wants to do something, there are enough linkages they can network thanks to the system which you have created, the ecosystem, the cluster concept. All these concepts actually should work out to the advantage of the student. And I'm sure we are going to see great. So 150 billion is not it is achievable, provided we do a good networking where we bring out the best in each of us. I think I'm sure it is possible. And Vivek, I must put my thanks to you for putting across the questions because you are in the field. So it was nice to see. Interestingly, Vivek has now shifted to artificial intelligence and biotechnology. That's what he's trying to focus on. So he has also kept moving with the time, but he has been in India all along. So I think we are very nice that we had two people, one who is putting the policies across and to create an environment, and another one who has been experiencing the effect of those policies at the ground level. I think it was an excellent meeting, and thank you both of you for sparing your time, and I'm sure we will try to publicize it more so that more can be done. Thank you very much, and thank you one and all.
Thank you, Dr. Renu. It's been a pleasure.
Yes. Thank you, Vivek, for asking very sharp questions.
Thank you so much. Thank you so much. Thank you, Anand. Thank you, Vivek.
Yeah. Okay then. Bye-bye.
Bye.